Hello everyone, I am Dr. Tisha Juggins, founder and owner of Inspired Life Psychological Services. Thank you for watching my video today. Stay tuned to this video because today I'm going to talk about EMDR therapy. It's one of the therapies that I am highly skilled and trained in, and maybe it can help you in your circumstances. So stay tuned and continue watching. Well, thank you for coming back. Today, I am going to talk about EMDR therapy. What is EMDR therapy? EMDR therapy stands for eye movement desensitization and reprocessing therapy. It's a therapy that uses bilateral stimulation, usually eye movements, to reprocess disturbing experiences. EMDR has been around for a very long time, and today I'm going to tell you all about it. What happens when we are traumatized? Most of the time, our bodies routinely manages new information and experiences without us even being aware of it. However, when something out of the ordinary happens and we are traumatized by an overwhelming event, our body's natural coping mechanisms can become overloaded. This overloading can result in disturbing experiences remaining frozen in our brain, and usually it's unprocessed. And those unprocessed memories are stored in our limbic system. The limbic system's traumatic memories can be triggered when we experience current events similar to the past experiences. So often the memory is forgotten, but the painful feelings associated with those memories are typically still present. And because of the present triggers, our ability to live in the present and learn from our new experiences can become inhibited. So EMDR helps create the connections between your brain's memory networks by enabling your brain to process the trauma in a very natural and healthy way. So what is an EMDR session like? So EMDR utilizes the natural healing ability of your body. And after a thorough assessment, I'll ask you specific questions about a particular disturbing event. And then we'll do some reprocessing around that event. First, we'll identify the goals. What's the experience you want to work on, and what is the belief system that you hold about the event? So once I get the information from the client, then I start to treatment plan. So EMDR happens in 8 phases. So this is phase 1, the client history and treatment planning phase, where we determine the goals of treatment and what we're going to be working on. Phase 2 is preparation and coping strategies. This is where I resource my clients with the necessary tools and skills needed to emotionally regulate in between sessions. Phase 2 is so important to me, and it's so important for my clients to have these resources so that they can feel safe in between reprocessing sessions. Phase 3 is the assessment. I look at all risk factors or anything associated with EMDR or limitations to my client's ability to reprocess effectively. So phase 3 is the assessment process. It's just as important as phase 2. Then there's phase 4, which is the reprocessing and desensitization part of EMDR. This is where magic happens, right? You may have some high emotionality because, again, you've held on to these beliefs and these traumatic and disturbing experiences for so long. You may have internalized, so you're going to see a lot of emotional movement here. This, again, is where the magic happens. So it's been said that repeat exposure to our distressing memories and experiences creates desensitization. This is a key component to EMDR. So this is phase 4. Phase 5 is installation. So whatever negative belief system you hold about the negative event, we're going to change that negative belief into a positive belief, and I'm going to install it into your mind. This is simply installing it through the use of eye movements. So remember, EMDR uses bilateral eye movements to reprocess. So I will install it with eye movements, and it will change your belief about the negative experience. Then I'll move on to phase 6, which is the body scan. This part is important because it lets me know if there are any upsets in your body after the reprocessing period. Some people have a clear body scan, they're ready to move on to phase 7. Other people might have some tension in their shoulders or knots in their stomach. And if so, I usually resolve those things before I move on to phase 7. Phase 7 is the closure phase, where we talk about what's happening, we wrap things up. I check in with you to see how you're doing, to make sure you're okay. Phase 8 happens the next time I see you. It's the reevaluation phase. I just want to be sure that it's the memories and the feelings associated with them have been resolved. So I will reevaluate your level of distress and see where you are in the moment. So that's the 8 phases of EMDR. Well, what does a session specifically look like? Because I'm a virtual only practice. So what I do is I use a system, and my clients on the video screen, I can see them, they can see me, and I activate the software. So I have my sounds going for the client, I have the dots going. The dots replace my fingers, because if I were in person, I would use my 2 fingers and go across the eyes like this. But the dots are my fingers when I'm virtual. And so that's going, and then I have the client think of the memory and their negative belief, and they're following the dots with their eyes as the sound is playing in the background. And we do this for about 60 or 90 seconds. And then I check in with them and ask them what they notice. And sometimes they want to share and sometimes they don't. I don't force it because my clients are in control. You're in control when you're doing EMDR. You don't have to. EMDR is magical like that. You don't have to do as much talking. Whereas if you were doing talk therapy, yeah, you would have to do a lot of talking. So EMDR is a very odd therapy, but a highly effective and phenomenal therapy for sure. Sessions typically last 45 minutes to 90 minutes, depending on the complexity of the issues. And I see my clients on a weekly basis because I want to make sure that they're okay, because you can continue to reprocess in between sessions. And so I like to see my clients on a consistent basis. So remember, when you have trauma, it is best to have the treatment that works for you. EMDR has been proven effective to work on children and adults. My youngest client was, I think, 4 or 5 years old. And the success rates are phenomenal. I have not had one person where EMDR has not been successful. But of course, everybody's circumstances are different. You know, research shows that EMDR is superior to Prozac when it comes to treating anxiety and depression. Prozac is a psychotropic medication that some people take for anxiety and depression. And EMDR has been proven to be superior to Prozac. So if that doesn't tell you how phenomenal EMDR is, I don't know what to tell you. That is amazing. So EMDR, remember, can treat anxiety and panic attacks, depression, stress, phobias, sleep problems, grief, loss, addiction, organic pain, self-esteem and performance anxiety. It can be used for a plethora of different things. So anyway, that is EMDR. If you are in therapy right now and you're just doing talk therapy, consult with your current therapist and ask about EMDR. It can be a game changer for you. If you've been in therapy for years and you're finding that talk therapy is just not working, I say again, consider EMDR therapy. I don't think you'll be disappointed. Again, I'm Dr. Tisha. Thank you for watching my video today on EMDR. I will leave some links below the video as resources for all of you. Thank you for watching. If you have questions, let me know. Until next time.